Nearly a year ago, in our College of Nursing retreat, we identified key messages that we felt represented the new curriculum and the new approach to nursing education at the U of S. Innovate, lead, excel, access, and discovery. Over the past 2 months, nursing students and our most recent graduates have demonstrated what it means when you put those words together in I lead. At the Saskatchewan Registered Nursing Association annual meeting, which was held in Regina in May, students supported a presentation that I did that used the World in Union song, which most of you would recognize from the movie Invictus. But if you're watching TV during the last few days and the World Cup Soccer Championship is on, being held in South Africa for the first time, it also demonstrates the power of a team. So the students worked with me to demonstrate what it means to be a team, to lead, and to work together for the profession of nursing. It wasn't about telling the nurses in the room what our new curriculum is, but rather showing the outcome of a curriculum that is situated in a university such as ours, that has the resources and has the investment of faculty that we have at the College of Nursing. So I want you to take a moment to look at the pictures and the words on the placards that the students indicated meant something to them as they shared it with the other nurses in the room. Many of these nurses also are preceptors that have supported nursing students as they've learned. More recently, last week at the Canadian Nursing Association meeting, which was held in Nova Scotia, students also participated. First, we had our a keynote speaker, Diana Swain, who does the CBC 6 o'clock news in Toronto, and she talked about quiet leadership. And what she talked about was the enormity of expectations that we have for leaders of today. And she shared with us her belief that leaders carve a new path, that they work in the dark, but they never lose sight of where they're going. And a presentation that was done by Professor Lois Berry and the group of students who were in L'Orange in 2009 for their senior practicum. In addition to their preceptor from the Lac L'Orange Indian Band, Chris Keast, presented on their experience there and talked about leadership through relationship development with the First Nations community. We also had the opportunity for our Saskatoon Student Society executive members to meet with Andrew Coyne. Now, I'm sure all of you would be familiar with Andrew Coyne. He joined Chantal Hubert and Alan Gregg on Thursday evenings on the show At Issue in the CBC News. And they talked about our knowledge economy, that knowledge economy was not related to age, but it's about education, and it's also about computer literacy. And they talked about nursing and how nursing is held in high regard by the public, and suggested that if we want to be politically active and be more involved in policy development, then we had an obligation to reach out to our constituents, but to do so with one voice. It's important that as students you have the opportunity to meet with these individuals, one, because in some ways they can be intimidated simply by who they are, but to realize that they do care about our profession, they care about the health of Canadians, and they care about you as individuals who will become the individuals who care for them as they enter into the healthcare system. So the last 2 months have been phenomenal in terms of opportunities for students to become engaged and to demonstrate leadership and to think about those words, I-L-E-A-D. Say it out loud and believe it as the individual saying it.
I will lead.
I will innovate.
Okay. I will discover.
I will provide access.
I will excel.
I will lead.
I will innovate.
I will discover. I will provide access. I will excel.
I will lead.
I will innovate.
I will lead.